Hello, my name is Bonnie Tinsley. Obviously, you probably saw my video in this discussion session because I got it all wrong and ended up downloading it into the wrong place. So I'm doing this to try to rectify that. Um, my my patient that we need to talk about is a patient that I got just last weekend who came in with nausea, vomiting, extreme weakness. She could barely speak. She was so weak. She had the nausea, vomiting, the diarrhea. She had a slight temperature, 99.8. She, her family said her mental status had changed, although for me, when I had her the first day, she seemed very with it and very alert and oriented. She was able to tell me who she was, where she was. She was able to tell me about her lupus and when she got diagnosed. It was 7 years ago. She was on some medications I had not previously been aware of. Plaquenil, which is an anti-malarial medication, and Benlysta, Benlysta. Those were two that I had not been familiar with, and they were administered for her history of lupus. She had a history of lupus, AFib, pneumonia, bronchitis, DVTs times 4. She had had multiple surgeries to relieve some joint pain. And when I looked up lupus and some of the side effects and trying to figure out what was going on with her, lupus, as you may know, is an immune system disorder caused by unknown etiology. We do know that there's something goes wrong with the part of the body that fights off infections, bacteria, viruses, that kind of thing. Usually it's triggered, surprisingly enough, by 70% of the diseased diagnosed people are it is triggered by sunlight. Can also be triggered by other infections, that kind of thing. I know that the diagnosis is very difficult because its symptoms are very wide and diverse, and they come and go. They come and go frequently. They could be as simple as nausea and vomiting to inability to get up and walk. So it does make it difficult. It can take years for a correct diagnosis to be made. Apparently, there are B cells in our body that make natural antibodies that protect the body from these infections. And some of those medications that she was taking, Benlysta specifically, attaches to that B cell and helps it to exit the body, because what happens is the B cells, from what I'm reading, can stay longer than they're welcome, and they start destroying. So her medications were Plaquenil, prednisone, which is the go-to for just about anything, Coumadin for her DVTs, and I think that's it, the Benlysta, the Coumadin, the prednisone, and the Plaquenil. The Benlysta has severe side effects, and after reading about the side effects, because the doctor who came up wasn't familiar with this medication either, so we pretty much all researched it together and learned that it is the first and only drug that is specifically produced and approved by the FDA for treatment of lupus. It reduces activity of the immune system. But it does, like I said, have very severe side effects, which in the end could be more detrimental. Lupus is a long-term debilitating kind of disease, and the medication can, in the way that it's attacking those B cells, it can actually work against you. So you have to really be careful with them. You can't. Benlysta, found cannot be given with blood thinners, and of course she's on Coumadin. So that raised some questions as to why. Obviously, the DVTs have to be addressed. She's had 4 of them already. So she died on the 2nd day. Her hemoglobin was 11.8 when she came in. It was 7.2 when I came back on my shift the next night. So within about 12 hours, she dropped substantially. But she was given 3 liters of normal saline in the ED for possible dehydration. Her IV fluids were going at 250 cc's an hour. So did we overhydrate her, thinking she was dehydrated? Not pay attention, because when I came in, her lungs were definitely wet, and she was definitely struggling. At the time that I came in, she was totally unresponsive, wouldn't respond to sternal rub, slept the entire shift until she died about 2 o'clock in the morning. And we pondered this for quite a while, for the rest of the shift at least, what it was that precipitated her death. Was it the new medication that she was given that had such severe side effects? Was it the disease itself? Obviously, it was probably a combination of all of them. But when you're thinking of the medications, it's hard to determine sometimes as a nurse why the doctor has administered medications you know should not be given together. So hopefully during this course and the subsequent courses we'll be taking, I'll learn more about that. Thank you for your time.